Sherlock, and I want to thank Deputy Smith for raising this issue, and I want to thank him for his kind words. It is appropriate in the first instance that we have this discussion on Ebola today, given the rapid deterioration in the situation in West Africa over the past month, and the cases now arising elsewhere in the world. And this debate is also particularly timely, given that the Ebola crisis was discussed, as the Deputy has referenced, the Foreign Affairs Council yesterday, and will be discussed at the European Council later this week. The latest World Health Organization figures are alarming. Well over 9,000 people infected by Ebola and 4,500 deaths in West Africa. Despite all the efforts of the international community, the likelihood is that the situation will deteriorate further before it improves. And I just want to say to the Deputy that I met with Mr Banbury when I was in Sierra Leone, in Freetown, and that was his indication to us that it would get worse before it gets better. Ireland has been very actively engaged at all levels in addressing the crisis on the ground and internationally, and particularly with the same gentleman, Mr Banbury. As the Deputy is aware, I travelled to Sierra Leone at the start of the month, and I did witness at first hand the devastating impact that Ebola is having there. And I came away from my visit with three very strong impressions. One, that there was a key gap in leadership and coordination, and I'm glad to say that the UN Emergency Ebola Mission, headed by Mr Nabarro and coordinated by Mr Banbury and called UNMIR for the purposes of this reply, that is now filling in a lot of those gaps. That there still are important funding needs, and that's recognised in yesterday's motion at the Foreign Affairs Council, particularly to scale up capacity for isolation and treatment. And three, that there is an urgent need for more international healthcare professionals to staff the isolation and treatment centres. Ireland is one of only a very small number of EU member states that actually has an embassy in Sierra Leone, and I was struck during my visit there by the very strong advocacy and coordination role being played by our Irish Ambassador-designate, Ms Walsh, and her very small and dedicated team. And we're working very closely there with the international partners, as well as with the Sierra Leonean government, and also with the US and the UK in the fight on the ground. The question of coordination is certainly the key issue if the Ebola crisis or virus is to be tackled effectively in West Africa, and its spread to other countries prevented. This was discussed, as the Deputy has referenced, in Luxembourg yesterday, and that was attended by Minister Flanagan. The Council's decisions yesterday represented an important further step in EU efforts to tackle the crisis by reaffirming the need to work together in a coordinated way and to pool our strengths. And I just want to assure the Deputy that when I returned from Sierra Leone, I felt very strongly that Ireland must use its influence at UN, through the European Council, to give a strong voice to the need to ensure that there is a pan-European or strong EU response to this crisis, because it won't be Ireland alone. The bilateral response is a powerful response in of itself, but it is not sufficient to tackle the nature of this crisis. And there is a clear need, and if we refer to health workers, there is a clear need for health workers, and this is recognised, and other key personnel to be represented on the ground. And the Council yesterday recognised very clearly the need to support international health responders and agreed that the EU will provide appropriate care for them, including the possibility of a medical evacuation if necessary. And that was a very positive step forward, and we must now work urgently to ensure that it is implemented in full.
Now, Deputy Smith, you have 2 minutes.
Yeah, thank you. I'd like to thank the Minister. Leone, I mean, I concur absolutely with the Deputy in relation to his remarks in relation to the efforts of the NGOs. If you take the work that GOAL is doing, if you take the work that Concern and Plan and other agencies, that work is extremely effective. And what we have done in terms of an Irish government response is we've said to Irish Aid we need to be flexible in our approach. And Irish Aid, in fairness to them, which is very close to the NGO community, and the Minister, or the Deputy, will be aware of this, we're now allowing them to pivot towards the Ebola response. The big concern that I have, though, as Minister for ODA, or Official Development Assistance, is that we have to be mindful of the fact that we need to ensure that we don't spark a humanitarian crisis in all of this as well. So, for instance, the nutrition programs that are being delivered on the ground need to continue apace. And so, I think you're right. Instinctively, I think you're right about the underreporting. I think, based on my own experience, it is only a matter of weeks ago since I was there. It is only at that juncture had the UN come in to Sierra Leone in particular. But now that Mr. Banbury is appointed as a coordinator, our ambassador is working very closely there in terms of liaising with the Sierra Leonean government to ensure that we help or assist in building out the infrastructure, that will treat medically, the cases on the ground, the people on the ground, and that response is happening. But I think it's a fair assumption that where you didn't have an international involvement at this juncture, or up until relatively recently, where there was a reliance maybe on the Sierra Leonean Department of Health or Social Welfare or Education, or whoever, to deliver the programs on the ground with the NGOs, that there was a certain lack of capacity there, and that the NGOs were punching above their weight. Now we have an international coordination around this. Different governments have, responded proactively. I do agree absolutely that the European response needs to be rapid. I think the resolution yesterday arising from the Luxembourg meeting, I think, is very significant, because it recognises for the first time the need to ensure that we protect health workers who go out there. But one of the issues that we were dealing with as a live issue when I was there was the need to ensure that local Sierra Leonean health workers were themselves paid. They hadn't been paid for quite some period of time. And I thank the Sherlock for his latitude. Now, it's difficult to expect an Irish worker to go out there, or a Spanish health worker to go out there, if the Sierra Leonean health workers themselves were not being paid and were staying away, and there was a strike at one stage. So those are the types of issues that we're dealing with on the ground, and we're very effective, and we're making very solid progress on those issues. But I do agree that the international response needs to be more proactive. But I do think for our part, as members of the European Union, I think we've had an influence in bringing that to bear in terms of our interventions through Minister Flanagan at the Foreign Affairs Council yesterday. And we're keeping a daily watch on this. Absolutely, because we want to ensure that, where possible, that the cases are dealt with medically on the ground and within the region. That is the most effective way of dealing with the cases.
I'm afraid we've gone way over on this time, Minister.